Hello everyone. My name is Chief Mrs. AYOYINKA Wilson. I'm a nurse and midwife by profession. I'm also the president of Enablers Diaspora Grassroots Support Outreach Worldwide. On this video, I'll be talking about cardiac arrest. I'll also let you know what happened during cardiac arrest. What are the clinical signs and symptoms of cardiac arrest? What are the causes of cardiac arrest? And what happened in case of cardiac arrest? What can we do? Now, for the sake of non-medical viewers, I want to talk about the term cardiac. What do we mean by cardiac? In medical term, cardiac means something that is related to the heart. Cardiac means it has to do with heart vessels. Cardiac means it has to do with treating and diagnosing disease of the heart. Just like any other organ in the body, the heart requires oxygen to function. Therefore, the heart first supplies its own muscles through the coronary arteries. Now we know about the what we mean by cardiac and the heart. Now, what is cardiac arrest? Cardiac arrest is when the heart suddenly stops pumping blood around the body. I repeat, cardiac arrest is when the heart suddenly stops pumping blood around the body. And what are the clinical signs and symptoms of cardiac arrest? A cardiac arrest usually happens without warning. Unlike when we are coming up with fever or malaria, you might have high temperature or headache, or you might have if you have cough, you might say, oh, maybe I'm coming with malaria, or maybe I'm coming with infection. But in case of cardiac arrest, it's so sudden. It will not warn you that I'm coming tomorrow, get prepared. No. And what happens to the victim? The victim collapses suddenly. The victim becomes unresponsive. The victim becomes unconscious. And the victim won't be able to breathe or not breathing normally. What do I mean by not breathing normally? That means they are making gasping noises. Hence, without immediate treatment or medical intervention, the person will die. Now, let's talk about causes of cardiac arrest. The common cause of cardiac arrest is a life-threatening abnormal heart rhythm that is called ventricular fibrillation. I know it's a medical jargon, yes. Ventricular fibrillation, we call it VF. What do I mean by VF? Ventricular fibrillation happens when the electrical activities of the heart become chaotic, that the heart stops pumping blood. Instead of the heart to pump blood, it quivers. I repeat, ventricular fibrillation happens when the electrical activities of the heart become so chaotic and the heart stops pumping blood. Instead for the heart to pump blood around the body, it's become quivers. Also, we have heart-related causes. And what are they? They have heart attack. That one too can cause cardiac arrest. I talked through heart attack. I said heart attack, they are caused by coronary heart disease. It can be caused by blockage due to clot or plaque. Also, another heart-related condition that might lead to cardiac arrest is what is known as cardiomyopathy. What do I mean by cardiomyopathy? Remember what I said, that cardiac has to do with heart. Myo, if you hear something myo in medical, means muscle. And pathy or pathology means disease. So now let's join that three things together, cardiomyopathy. That means it's a disease of the muscle of the heart. So now in cardiac arrest, what happened? Why cardiomyopathy? How can it lead to cardiac arrest? The heart muscles, in case of cardiac myopathy, if the cause of cardiac arrest is cardiac myopathy, the heart muscle becomes stretched. They become thickened and stiff. And this affects the heart's ability to pump blood around the body. Also, another heart condition, another heart-related cause of cardiac arrest is congenital heart disease. Congenital heart disease is a condition that is present from birth. Also, we have another heart-related cause that is known as heart valve disease. Our heart is divided into 4 chambers and it's got valves, or 4 valves to say. The valves comes open and close, open and close, open and close. When there is disease and there's valves, it can lead to cardiac arrest. Also, there is a condition that is heart-related as well, that is known as acute myocarditis. What do I mean by acute myocarditis? I'm going to break it down. Acute means sudden. Anything myocardiac is the middle muscle that surrounds, that is inside the heart. And TIS, myocarditis is inflammation. That means the heart muscle become inflamed. If the heart muscle now become inflamed, there is reduction in the ability of that heart to pump the blood, the required blood to the body. And that is what happens in an acute myocarditis condition. Also, we have other causes that is not heart related. And what are they? This can be electrocution, also drug overdose, yes. Also severe hemorrhage, that is loss of blood, and hypoxia. What do I mean by hypoxia? Hypoxia is caused by a severe drop in oxygen level. Yeah, now that we know the causes of cardiac arrest, how do we treat cardiac arrest? For cardiac arrest, we need to start immediately what is called CPR. CPR is cardiopulmonary resuscitation. It is vital as it keeps the blood and oxygen circulation to the brain and around the body. My next video, I'm going to talk us through cardiopulmonary resuscitation procedure. And also there's a very important machine that is very, very important called defibrillator. What defibrillator does is defibrillator is equipment that is used to control the electrical shock, to try and set the heart beating normally again. It's like jump start, to jumpstart the heart. It has got like electric shock to jumpstart the heart. It is very, very important. If you are with someone having the cardiac arrest, please, it is very important to call emergency number 999 and to start cardiopulmonary resuscitation and defibrillation if you have access to the machine equipment, please. Next video, I will talk us through cardiopulmonary resuscitation procedure, and also I will talk us through recovery after cardiac arrest. Do subscribe to our YouTube channel, Enablers Diaspora Grassroots Support Outreach. We're on YouTube. Like our Facebook page, we're on Facebook, and we are also on Instagram. Also, we're on Twitter. Thank you very much for listening, and bye for now.